Usually she's here, what is she doing? Must be busy.
I have to just scratch its throat. I was trying to clear it before I talk.
Okay. You have your water handy?
Yes, I have everything. I have my water and my tea.
Oh, nice. All right. Well, welcome to you. It's been forever.
1 second. 1 second, please.
Okay. Dr. Monica
Say that
Martin.
again, please.
I'm saying it's been forever, Dr. Martin. It's been forever.
Oh, been forever since my Christmas party that I saw you.
Yes, but our audience have not heard a word out of you.
I know exactly what you mean.
So you have some apologies to make.
I apologize profusely.
Oh, yes, please. Nice hearing you. Welcome, ladies and gentlemen. It's the second Thursday feature of the show. The segment is called Health Zone, and my guest, my Dr. Monica Martin, she's on. Hey, Pat. And we're going to be talking about the brain this evening. And I'd like to learn a little bit about what's going on up here. I'm actually touching my head.
Well, as you know, I'm a gynecologist, but I thought of saying something about the brain because, you just to watch people go along their everyday life, you realize they don't think about the brain much.
Mm-hmm.
They think about their hairstyle and their eyelashes and their feet and hands and even the heart, their cholesterol, but the brain just sits there,
yes,
being ignored.
Yes.
So I think I would say a few words from what I remember of what I learned many years ago.
And of course, it is a very vital topic because after you have given us the information, I'm sure you're going to leave us with food for thought.
Okay, I hope so.
Welcome, ladies and gentlemen. The segment brought to you by Cooler Runnings Jamaican Restaurant, 1802 Nereid Avenue in the Bronx. My name is Denise Lady D. Gomez. The segment is called Health Zone. Dr. Monica Martin will be here right now. She's here to talk about the brain. How many of you know about the brain? Dr. Martin, go right ahead. Let's start talking.
I just want to know, are you hearing me clearly?
Very well.
Okay.
Yes.
The phone sounds a little scratchy. Okay, so, I usually like to start with a scripture.
Go right ahead.
I've repeated this one so many times, but I like it. It's always relevant.
Mm-hmm.
And it's Psalms 139, verse 14, where David said, Lord, I will praise you, for I am fearfully and wonderfully made. Marvelous are your works, and that my soul knows very well.
Yes.
The brain is one of the most amazing, marvelous organs in our bodies.
Mm-hmm.
It serves, of course, many important functions.
Mm-hmm.
It gives meaning to things that happen, in the world around us. Our impression of dimensions and our environment all has to do with a wonderfully functional brain.
Mm-hmm.
We have 5 senses. All of us learn that in school.
Yes.
Seeing, hearing,
Smelling,
tasting, and touching.
feeling, yes.
The brain relies very much on those senses to bring information to it so it can take care of our bodies.
Mm-hmm.
And sometimes the brain receives messages, so many different messages at the same time, but it has to sort every one of them out.
Mm-hmm.
The brain, of course, controls our memory, our thoughts, our speech, our arm and leg movement, the function of in fact, most of our organs depend on the brain. The heart is very vital, but without a brain, the heart would not even move.
Mm-hmm.
It determines, the brain tells us how to respond to situations around us, stresses, taking exams, losing a job, childbirth, all these things, the brain has to jump in to help us out.
Mm-hmm.
So, like I said, in medical school, my school, which I'm grateful for, even though I didn't become a neurologist, I'm grateful that they really expose expose us so much to the brain, and that we as doctors, no matter what field we go into,
yes.
would always be conscious of that. You know, when we're born, the brain weighs about a pound. When we get to adults, it's about maybe 3 pounds. However, if you look at the anatomy of the brain, I'm sure everybody has seen the brain, all these curls and waves and these curly things that make up the brain. I think God designed it like that because if the surface area of the brain is so large that if all that area was spread out, then we would all have very large heads.
Yes, yes.
So what if the brain is folded in on itself and curled in so that all the information can be stored and assimilated, but in a space that's reasonable for our head, shape and size of our head. And it bothers me sometimes when I see people, which, you know, I love sports myself, but certain things that involve the head just makes me cringe, because if you look at the head, you tap your head in that skull there, it's very, very hard. It's almost a centimeter, maybe a centimeter deep, you know, why that bone, the cranium is called. And that cranium is there, obviously, to protect our brain. So if you fall and you hit your head on the concrete or anywhere on the street, you go to the emergency room, most of the time they say you're fine, because that hard cranium serves as your protector. So to injure it to the point where it breaks or it damages or the underneath area is damaged, you have to give yourself a hard blow, like some of these sports. You know, and then apart from that cranium, we also have, you know, different layers that protect the brain even more. They're called, you know, meninges. I'm sure everybody ever heard about meningitis.
Yes.
So the meninges are like layers. So underneath that skull, you still have more things going on. You know, you have the cranium, and then you have 3 different layers, again, called, I remember when I used to study the dura mater, arachnoid mater, and pia mater. And those are the 3 layers. The first one is a top one. The second one is kind of arachnoid, come from the word, I think it's Greek, that means spider. So it's like spider-like, you know?
Yes.
And it has little blood vessels and little collagen and fibers. And then under that now you have the pia mater, that's the one that sits right on the brain. It's like a beautiful protective layer. It's just laid down all over the brain, including those little dips and falls that we see on the brain. Each one is covered and protected. And this, you know, supplies the brain with blood supply, so we can function. And then in between there, you have the spinal fluid, which is also another protection for the brain. So under the arachnoid space, you have the fluid, the spinal fluid, which protects the brain also and keeps moisturizing the brain and the spinal cord all the way down, up and down. All those nerves are protected like this. And then you have a little thing in there, I think it's called the choroid plexus. That's the one that makes sure fluids are always going and pumping. So the brain has a lot of things going on to make sure that we function. And so raising the consciousness about the brain, I think, is very important, because if people really know how delicate it is and how wonderful it is, we wouldn't take it for granted like that. You know?
Yes, yes. But
am I talking too much?
No, I'm just about to ask you a question, because I wanted, no, Dr. Martin. But I wanted to ask you, how much, would you be able to tell us, how much oxygen does the brain need to stay functious, to stay conscious?
Well, when you say how much, I can't really give you, like, you know, measurement in volume, but you have to have a certain amount of blood supply. All these blood vessels that I haven't gone into those, but there's a lot of blood vessels sitting there that send. That is why if something is happening to you, the body tends, if you get into an accident, also the body tends to remove blood from, as they say in the business, remove the blood to vital areas, because the brain is one of the first places. If you have a crisis, the blood runs to that. The blood will run and leave the other organs, but it goes to the brain. Mm-hmm. So the brain has to be supplied with a significant amount of blood, which is what carries the oxygen, for it to function at a high level. Okay. A lot of times when people have, symptoms like dementia and Alzheimer's and those things, it's usually because over the years there have been scar tissue from different kinds of damage to the area that cause scar tissue. When you have scar tissue in the area, the blood supply is not as fluid. The blood doesn't run as nicely to the tissues. Mm-hmm. So if certain parts of the brain are deprived of oxygen and blood supply, these adequate amount of those, then what you have is the part of the brain that's affected the body will manifest itself. In other words, there are different parts of the body for different functions. Mm-hmm. You have the frontal lobe, that's the big lobe in the big part of the brain in the front, it's the frontal lobe. Mm-hmm. That's the one that deals with intelligence and thinking and organizing. And, you find that if somebody has any kind of damage, even from trauma, then they, or any other diseases that affect that part of the brain, then they can't organize. Somebody who's such a great organizer and wonderful thinker, and all of a sudden they can't think